Bismillahirrahmanirrahim. Today in this lecture, we are going to discuss the pharyngeal pouch. The pharyngeal pouch is also named as hypopharyngeal diverticulum or Zenker's diverticulum. It is a pulsion diverticulum in which the pharyngeal mucosa herniates through the Killian's dehiscence. What is Killian dehiscence? Killian dehiscence is a weak area between the two parts of the inferior constrictor muscle of the pharynx. This inferior constrictor muscle of the pharynx consists of two parts, thyropharyngeus and cricopharyngeus. Between these two parts of the inferior constrictor muscle, there is a weak area which is called the Killian's dehiscence. In this figure, you can see that there are two parts of the inferior constrictor, thyropharyngeus and the cricopharyngeus. In between these two parts, there is a weak area through which the pharyngeal mucosa may herniate, producing pharyngeal pouch. Etiology. The exact etiology of the pharyngeal pouch is not known. However, there are certain risk factors which predispose to develop this pouch. This pharyngeal pouch is usually seen in old age people above 60 to 70 years of age. It is more commonly seen in males as compared to the female, and the male to female ratio is 5 to 1. Some ENT surgeons think that it is due to the spasm of the cricopharyngeal sphincter, whereas other otolaryngologists have the opinion that it may result due to uncoordinated contractions of the cricopharyngeal sphincter during the act of swallow. Initially, the pouch makes its appearance in the midline after herniation through the Killian dehiscence. It is first behind the esophagus and then it comes to lie usually on its left side. In majority of the patients, the sac is wider as compared to the opening of the esophagus. That's why food gets an entry easily into the pouch. Now you can see here the pharyngeal pouch having quite a big sac, and in this figure in the radiograph, this is X-ray of a patient having pharyngeal pouch. The esophagus is outlined, but the opening of the esophagus is narrow as compared to the sac itself. That's why the food makes easy entry in the sac rather than to go towards the opening of the esophagus. Clinical features. Dysphagia. This is the most important and prominent feature of pharyngeal pouch. Dysphagia appears after a few swallows when the pouch is full of food. This food-filled sac then presses upon the esophagus, causing dysphagia. Then gurgling sound is produced during swallowing act, which even can be heard by the patient himself. Chronic cough due to regurgitation, especially at night when the patient is recumbent. The patient will have weight loss due to dysphagia. The patient may be having a lump in the neck which gurgles on palpation. The patient may have bad smell from the food decaying in the pouch. Sometimes vomiting of undigested food material eaten by the patient a few days ago. Complications. Aspiration pneumonia. This is due to regurgitation. Second complication is carcinoma. This carcinoma is the squamous cell carcinoma, which may develop in some of the patients in long-standing cases of pharyngeal pouch. Although the incidence is very low, ranging from 0.3% to 7% only of the pharyngeal pouch cases. Diagnosis. Diagnosis is made by history, clinical examination of the patient, and certain important investigations, of which one is X-rays barium swallow. It will show the sac and its size. Secondly, second important investigation is the esophagoscopy. Esophagoscopy should be performed very carefully because of the danger of the perforation. Secondly, the esophagoscopy should have a diagnostic role as well as to rule out the carcinoma, which is a complication of this pouch, although it's a very rare complication. Treatment. There are certain surgical options of treatment. One is that excision of the pouch and cricopharyngeal myotomy. This is done through the cervical approach. Second is the Dolman's procedure. This Dolman's procedure is the division of the partition wall between esophagus and pouch by diathermy through an endoscope. The third option of treatment is the endoscopic laser treatment, that is division of the partition wall by using carbon dioxide laser using operating microscope. Thank you so much. This you can see, this is the radiograph of a patient having barium swallow showing you the sac. Again, the sac is seen in pharyngeal pouch. This is the end of this lecture. Thank you so much.